Genetic testing is very important for our population because we need to be able to give equitable care to everyone, and expediting their care with genetic testing helps us give them care in a timely manner.
Historically, minoritized communities face many barriers in accessing genetic services. The expansions that we have been able to implement with the support of DHS over the last year and a half have allowed us to magnify our reach.
One of the biggest needs in healthcare these days is trying to understand the reason why some genetic conditions occur, right? And the only way that we can address that is to provide a test that's as comprehensive as possible. And in order to do that, you need to have a lot of people whose genetic variation has been looked at. But all of our databases are very skewed and mostly have representation from Northern European ancestry. And so by participating in the process of genetic testing, we're learning a lot about how to help patients from different backgrounds.
We want to understand who is at risk, test them before they are affected, and then there are preventative or prophylactic things we can do often to then prevent disease in those patients. Abnormalities at the genetic level can put a patient at risk of many cancers. Those can be breast, ovarian, endometrial, colorectal cancer, pancreatic cancer, and various endocrine cancers, to name a few.
We have so many patients that need genetic testing. Many of our young patients have aggressive subtypes of cancers, and having those results in a timely fashion will let them think about whether or not they would like to pursue bilateral breast surgeries, or even if they want to be considered for reconstruction.
DHS established a multidisciplinary genetics and genomics optimization program to develop and align best practices for screening, testing, and counseling of conditions to address inequities in care and improve outcomes.
So we've developed, for example, expected practices for all physicians in the county so that if they have any questions or concerns about a patient, they can actually refer to a document that tells them, if your patient has this kind of symptoms, review what the practice guideline tells you to do. And if you find that at the end, the answer is see a geneticist, then go ahead and do that.
We have extended the resources to include multidisciplinary types of providers. So that can be community healthcare workers, nurse practitioners, genetics assistants, geneticists, genetic counselors.
We did this pilot here at Oliveview where we used a bilingual, bicultural community health worker to screen patients for their family histories.
Here at the GYN clinic or the women's clinic, that questionnaire is provided to the patient. In particular, the patients that I have screened are patients that don't speak English. So I have been able to assist them in their native language, which is Spanish.
At this point with our program, we have screened about 2,000 patients, 230 of whom were identified as high risk and have undergone testing. Adding a community health worker to that genetic counselor has increased our capacity to do genetic education and testing 2.5-fold.
In the space of 1 week, our team can now see as many patients as it used to take me more than a month to see.
We can make a meaningful impact in patients' healthcare and particularly in children's lives. So being supported and being part of a team that's actually making that change, that can be a national model for how this type of care should be implemented, is what makes me very happy to work with this team.